What is cerebral palsy? Cerebral palsy is combined into two different words. Cerebral refers to the cerebrum, which is the affected part of the brain, and palsy, which refers to brain injury resultant of the disorder of movement. Cerebral palsy is a group of motor conditions that causes physical disability in development, primarily in various areas of body movement. It is caused by damage to the developing brain motor control centers.
How many individuals are affected by cerebral palsy? Approximately 1 in 345 children in the U.S. have cerebral palsy. There is a higher prevalence of CP in children born preterm or at a low birth weight.
What age group is affected by cerebral palsy? For every 1,000 babies born in the United States, 3 will be diagnosed with some type of cerebral palsy by the time they are 8 years old. Out of 764,000 that live with cerebral palsy, 500,000 of those are children and teens. Each year, 8,000 to 10,000 infants are diagnosed with this disease, and 1,200 to 1,500 preschool-age children. The majority that live with this disease are people under the age of 18. Types of cerebral palsy. There are 4 types of cerebral palsy, and each have their own unique movement disorders. The first one is spastic CP. It's the most common type of cerebral palsy and affects about 80% of people with this disease. Spastic cerebral palsy increases muscle tone, which means the muscles are stiff, which results in movements to be awkward. Dyskinetic CP. A person with dyskinetic cerebral palsy has muscle tone that can change and varies from being too tight or too loose. Dyskinetic cerebral palsy causes problems in controlling movements of their hands, arms, feet, and legs, making it difficult for them to sit and walk. Their movements can be jerky and rapid. Ataxic CP. Individuals with ataxic cerebral palsy have problems with balance and coordination. They may be unsteady to walk and have trouble to do things that require quick movements, or movements that require a lot of control, like writing. The last one is mixed CP. Some individuals have more than one type of cerebral palsy.
Children with cerebral palsy may experience a variety of mental, emotional, and physical symptoms. This includes, but is not limited to, trouble swallowing, trouble with eye focus, reduced range of body motion, blindness, deafness, trouble walking, difficulty speaking, and delayed growth.
How is this disease diagnosed? Cerebral palsy is typically diagnosed during the first or second year after birth and can be seen by course of development in child's performance. It takes time and many tests for it to be diagnosed. Cerebral palsy is not easily diagnosed. It must be preceded by an extensive interview and analysis of the course of the child's development and the results of additional tests. Some tests that can be made to help determine CP can be magnetic resonance imaging, MRIs, and X-ray computed tomography. Healthcare providers will also examine a child's control in movement, muscle tone, growth, and development, also coordination and balance. While examining, the healthcare worker will look for signs of CP, then may scan the brain to look for damage in the brain.
One organ system affected by cerebral palsy is the central nervous system. One pilot study of children in Canada explains that although chronic pain is common in children with CP, little is known about short-term pain fluctuations and their impact on children's well-being. High-quality cohort studies are needed to understand the clinical course of pain in this population. According to the Mayo Clinic, cerebral palsy is a group of disorders that affect movement and muscle tone or posture. It is caused by damage that occurs to the immature developing brain, most often before birth.
Is cerebral palsy preventable or treatable? Cerebral palsy is a lifelong disorder with no cure but treatments that can help this disability. Cerebral palsy is not preventable, but there is steps you can take to lower the risk before pregnancy. For example, eating well and having medical problems under control, taking recommended vitamins, having regularly checkups, and screens for complications. There are treatments for CP that can help improve symptoms such as medication, surgeries, and therapies. Treatments that are given to patients with CP can vary from gender and age group. Of the treatments prescribed, gender differences were observed for spinal braces and having undergone SDR. A statistically significant difference based on place of birth was noted for spinal bracing and having received IDB treatment. Women's Health Weekly 2020. Surgeries can help improve mobility and may help with pain such as muscle and tendon release and even dislocation of the hip. Common therapies used to help children with CP start from physical, occupational, speech, music, and feeding.
Many people wonder what it's like to live with cerebral palsy and fight its troubles every day. Unfortunately, parents of children with cerebral palsy may experience limited opportunities for a better life. Sometimes receiving much-needed government support can be difficult. It is also hard to find a home that fits the needs of the child with cerebral palsy. Here is an example from the experience of Erica Chance and her son, Aiden. In 2017, an appropriate unit became available, but Cass says Chance's salary was miscalculated by the housing authority, so she was not allowed to move in.